needling here on the distal quad. First, we want to make sure the area is nice and clean. Really the biggest concern is just removing any visible dirt or debris on the area. I like to swab it with a couple alcohol swabs beforehand though, to make sure the skin's clean before we insert the dry needles in. And so here I have 1-inch needles. They're 34 gauge, so quite small, and they'll do the trick on this area. The dry needles actually go all the way up to 4 and even 6 inches depending on the area you're stimulating. The shorter the needle, the longer they usually need to be left in to stimulate the response. But this will do the trick for us, and typically a session of 10 or 15 minutes is long enough to leave the needles in. But start off, we clean the skin. I'll palpate around now, looking for areas, again, with the tension, extra pressure that we find there. And when you find a spot, you just mark right next to it, and you have a shaft that the dry needle's in. And then just with a simple flick, you just flick it, pull the shaft off, and then just like you're driving in, you bring your fingers on top and you go straight in. And then if you do actually get a trigger point, you will oftentimes feel it release, or will feel a slight spasm and then a release under there. And you just repeat this process as you go around his distal quadriceps here, looking for areas of increased tension. And the biggest things you're concerned about around this area, a little bit less, but would be going into a nerve. The patient will report pain going down their leg. At that point, you would want to redirect the direction of the needle at that point. If they're having more localized pain, there's different things that we do. We can do a pinching sensation around the area to desensitize the area, and sometimes even rub right next to the area that we're going to insert the needle at, and that'll reduce it. And you do the same thing as you're driving the needle down, and patients will often tolerate that a little better. If they have localized pain while dry needling, we leave that in. Oftentimes the pain will resolve in just 3 or 4 seconds. However, says he has pain right here and it's going on, oftentimes we'll just insert another one right next to it, and that'll actually relieve the pain that they're experiencing. And so with him, we would do a dozen or 15 even different needles through this area as we find areas of trigger points. Leave them in for about 15 minutes. Another way to stimulate the effects even quicker is to use a stim, similar to what you do transdermal, except actually attaching them to the needles to speed up the process. And that can work on several areas of the body as well. So this is a simple lab showing the distal quadriceps and dry needling.